Welcome to Mejo's docuseries on health entrepreneurship. Entrepreneurship in healthcare is vital for addressing Africa's unique challenges and creating sustainable solutions for communities across the continent. In this series, we explore the journeys of three extraordinary leaders: Dr. Clarke, an Irish-Ugandan physician, entrepreneur, and philanthropist who founded the Chiwoko Hospital and the International Medical Group in Uganda; Dr. William Mapham, a South African ophthalmologist and founder of Vula Mobile, the oldest African health tech company connecting hospitals to specialists; and Tonny Natif, a Ugandan pharmacist, activist, and founder of Garden Health Pharmacy, one of the largest with over 19 stores. Their stories reveal the lessons, challenges, and triumphs that define healthcare entrepreneurship in Africa. Through their experiences, we aim to inspire the next generation of changemakers in healthcare. As we conclude, these leaders leave us with invaluable advice for the next generation of health entrepreneurs. Their words are a beacon of hope and guidance for those ready to take on the challenges of healthcare innovation. Listen closely as they share their parting wisdom.
Don't jump into doing something with no experience. Do the cesarean sections, do the hands-on stuff for a bit. Doesn't mean you're not going to do public health, global health, some other stuff, but do some clinical medicine before you branch out into whatever it is that you're doing. I think you can afford, you have time with you. And then also, a book called Thinking Fast and Slow, and it comes into the whole thing of the rational brain stuff, but there's another interpretation of that. I was listening to somebody who was talking about building big enterprises, and he said, think slow and act fast. Now, what he meant by that was sit down and consider your plan. Now, he was talking about building mega projects, and he gave the example of the Empire State Building, which apparently that building went up so fast because before they built it, they had really worked out their plan. Now, I'm definitely an exponent of the idea, just do it, get on with it, don't spend all day considering and never going anywhere. But at the same time, also think, where do I want to be in life? What do I want to do? What are my gifts? And work some stuff out. Do I need to go and do a fellowship in a different country? Should I be? There's a guy I know who said, I need to be in Silicon Valley to be doing what I need to do. So I think I often just rushed in and did the thing, and it worked out. It was fine. It's better than, I'd say the worst thing you can do is do nothing. You just let life carry you along, and that's the person with a linear progression, which is okay. But if you really are more deliberate, intentional, and you think, what can I make of my life? And you begin to try and map it out a bit, and then move on that, even if you get out of your comfort zones. That's another thing, is people don't like to get out of their comfort zone. I've got out of my comfort zone so many times. But when the alarm goes off at 5:45 in the morning, I have to get out of my comfort zone in bed. So there's certain principles, but I do think that you guys can sit and say, where's the world today? Understand your environment, understand what you're facing. Don't assume it's Uganda. Uganda's a little part, and then how can I be best positioned to do this? Where am I going to have the best opportunities to move forward? Unfortunately, a lot of brilliant Ugandan doctors are in Canada or somewhere, and I don't begrudge them being there because they're getting the best opportunities, which they're not getting here. And I do feel like I would never advise a young doctor, oh, you're a doctor and there's a few doctors here, so you must stay here. Well, look, if I'd said in Ireland, I wouldn't have been able to make a difference here. So you can make a difference wherever you are. And, if that's in Uganda or Africa, that's grand. If it's in America or Canada, that's also grand. But it's got to be the fit for you.
Okay.
answer this question is to encourage people to fall in love with the problem, not the solution. So if you got a passion for improving a particular type of medical care, rather fall in love with that and then use whichever tools you need to solve that problem. I think that often people think, oh, I've got a cool technology, I can put it into healthcare, and you can do that. But I think the better thing is to look at the problem and find the solution, whether it's technology or not. So for example, even with Vula, we had to add a print function because patients needed to carry something with them to be able to go through security at a hospital. If they didn't have a referral letter, a physical one, that they couldn't enter. And so sometimes the solution is paper, and that's what you got to do. So I think that don't fall in love with the technology, rather look at the problem you're trying to solve and then work around that. So maybe I took the long route around, but the quote I like is from a presentation from I think it was one of the NHS doctors who came out to talk about innovation. And he said that if you provide value, the money will come. If you just want to make a quick buck, you can do that, but you won't provide value. So I think that we've taken the approach of, can we develop so much value and be so indispensable that people actually pay for Vula? But it has taken a long time. So from 2014 to 2018, we had no revenue, and we're basically still kind of proving the model, really. There were then, I think, four publications on Vula. There are now 11, so it's been independently tested and verified. And it was only in 2018 we got our first advertising contract, and we thought this was going to be the magic. And then we worked out that it's not like if you make more impressions you get more money in healthcare. There are only a certain number of companies that advertise to healthcare workers in the public sector in South Africa. So it's not like there's an unlimited market, and it was actually quite small. And in fact, we've just phased that out now. So we thought that this was going to be a big source of revenue, but it actually wasn't. And we were spending more money getting advertisers than we were making money from the advertising last year. So we realized this wasn't really going to be a good sustainable model. And then in 2020, we got our first, what we called a health systems contract. So there was an organization that said, look, Vula does provide value. We know it makes the system better. We'll pay for you to do it in this area. And so up until today, those are our sort of big major contracts. So the patients aren't paying, the healthcare workers aren't paying, but there's someone at the top paying. So it's a bit like your organization having a Zoom license. The individual people that use Zoom don't pay, but there's someone paying for the license fee. We also had two large data contracts, three actually over the last 2 years. And so we thought, again, the data was going to be a major source of revenue, and it is. But actually, what are we getting most of our revenue from is from doing what we do, which is the referral system. My mother was a librarian, so we grew up with books. So, always reading, whether it's fiction or nonfiction or business books, they're all interesting. And we did an analysis of our spend at home to see like where we could save money or spend money. And my two biggest expense are cheese and books, which might tell you a bit about my lifestyle. And then I guess I've always looked for ways to learn. And sometimes they're local, so you can do courses close to home. Often you can learn a lot from other people in the same ecosystem, so health tech hubs, or just friends in the industry who you can just pick up a phone and chat to, or mentors. And I think actively seeking mentors really helps, especially ones that can help you in your own environment. So for example, like my prof, who was super helpful for me. And then also looking for kind of more business things, because I hadn't obviously had any business training. And I would really recommend anyone to apply to the Stanford Seed program, which I did last year. And that was super interesting because it was, I think, 120 CEOs of African companies, not just from health tech, from a whole range of things, from farming, restaurants, logistics, waste disposal. It was absolutely incredible to learn from that group of people, because from a business perspective, it can be lonely because you think that you are on your own. But when you have a network like that, then suddenly you feel supported. So you learn a lot from the network. And then also the course material covered things like finance, financial modeling, how to bring value into your company, things I didn't even know I didn't know. And so I think that courses like that really helped me develop and learn things I needed to know. But I think, like you said, like it never stops. The world is evolving. And so, learning a lot more about AI. We've done 2 experiments ourselves. Sometimes you learn more by doing than on a course. So yeah, I think it's not as easy as people think, but it's something that we need to learn about.
In our last year of O level, I was the math teacher. Up to today, some guys from Namiango call me Musomesa. We didn't have a math teacher, so I'd go and read ahead, come back and teach my classmates, and we got the most D1s as a stream. But I got so much value because I understood the mathematical concepts much better. I wasn't that great at math until that time when I started teaching my guys. And so teaching is the best way to learn. So find mentors, but also be a mentor, and you never forget these lessons. Also, just doing and failing and taking the lessons. I take more lessons from failure than I take from success because I hate to fail. That pain sticks more, and it's educational. Yeah. But don't make money your primary goal. Make solving a problem your primary goal. Once you solve a problem successfully, people will move through thick and thin, through hills and valleys to come to you, because no one solves that problem better than you do, and you will make money.